Thinking back to a time when one of the ways of knowing went wild reminded me of a postpartum hemorrhage that happened on our unit. It happened a couple of months ago, and a different nurse on the unit was taking care of the patient, but a couple of us jumped in to help her when it happened. And in this situation, I believe that the empiric way of knowing mainly took over. The aesthetics played a small part, but mainly it was the empiric way of knowing. And I believe this happened because of a postpartum hemorrhage simulation that we had had recently. The nurse educator on our unit got together with one of the doctors, and they created this postpartum hemorrhage simulation for the doctors and nurses to go through together so that we could be more efficient when postpartum hemorrhages occur on our unit. Also, I've had a few patients that have had postpartum hemorrhages in the past, and so I think that played a role too in guiding me on where to focus priorities and what should be done next. And Chen and Kramer actually describe part of the empirical way of knowing. They describe scientific competence, which they say involves conscious problem solving and logical reasoning, but much of the underlying empiric knowing that informs scientific competence remains in the background of awareness. And I think that's what was happening in this situation. I wasn't thinking in a step-by-step process of this is what we did in the postpartum hemorrhage simulation, this is what we need to do next. But I think that was in the back of my head guiding me through what steps we needed to take and what we needed to do first in this situation. I think that in order to add in some of the other ways of knowing, I need to just experience more emergency situations or postpartum hemorrhages, and I think that will help me with gaining some more background. I think ethical knowing did play a little bit of a part in this situation, basically just because we were doing what was right for the patient in the moment. But I don't know if there's a way to increase ethical knowing in this situation particularly. And as far as aesthetics, I think that will come more with more experience with postpartum hemorrhages or emergencies along the lines of a postpartum hemorrhage. I think once I experience those more, then I'll have more of that intuition and past knowledge to guide me in future situations. Empiric knowing has both strengths and weaknesses. I think one of the main strengths is that it creates a good foundation for nurses to base their practice on, especially newer nurses who don't have as much clinical experience and haven't built up those other patterns of knowing such as aesthetics or personal knowing. They can rely on what they know from empirical knowing to guide their nursing practice. Another strength of empiric knowledge is that it's evidence-based. So there's scientific research and evidence to back up the theories. One of the limitations of empiric knowledge is that sometimes it has the potential to be used in situations where it doesn't actually belong. Another limitation would be that sometimes someone can focus just on empiric knowledge, like we discussed earlier, when one of the ways of knowledge goes wild and sort of blocks out all of the other ways of knowledge. Just like Chen and Kramer state that nurses need to rely on clinical reflection that yields best judgments to guide practice in a particular situation that is informed by all sources of knowledge. So I think that's one of the main points, is that we need to integrate all of the different types of knowledge in our practice and not just focus on solely one type of knowledge, such as just using empiric knowledge or just using personal knowing. It's important to use all the different types of knowledge together in a situation so that we can take care of our patients the best that we can.